My patient Walter was 73. Healthy checkup, normal blood pressure. He laughed walking out of my office. 3 weeks later, his wife woke up on a Wednesday morning and he was gone. Died in his sleep. No warning. I went back through everything, and what I found were 6 things Walter did every single night, things I never asked about, that were silently destroying his heart while he slept. One of them you are almost certainly doing right now, tonight. I'm Dr. Deborah, William. Stay with me, because number 1 on this list is what nobody is talking about, and it is the reason healthy people don't wake up. Before we start, drop a comment right now. Tell me your age and whether you've ever woken up at 3 in the morning with your heart racing for no reason. I read every single comment. Your answers matter to me, personally. Let's go. Number 6, eating a large meal within 2 hours of bedtime. I know, you're thinking, really, Deborah? Food? That's your big warning? Hear me out. When you eat a large meal, your body diverts a massive surge of blood flow to your digestive system. Your heart works significantly harder to make that happen. For someone in their 30s, that's manageable. But researchers at the University of Sao Paulo found that in adults over 65, the cardiac stress after a large meal raises blood pressure by an average of 22 points and keeps heart rate elevated for up to 3 hours. Now picture that happening while you're lying flat, asleep, already in your most physically vulnerable state. There's something else. When your stomach is full and you're horizontal, acid travels upward far more easily, and when that acid hits a certain nerve cluster near your esophagus, it can trigger irregular heart rhythms. After 70, the valve that keeps that acid down weakens considerably. This stops being a comfort thing and starts being a cardiac thing. The fix is simple. Finish your last full meal at least 3 hours before bed. If you're genuinely hungry, a few walnuts or half a banana is fine. Then, take a 10-minute walk after dinner. A study out of the University of Limerick showed that a short post-meal walk cuts blood sugar spikes by 28% and takes real pressure off your heart during the night. Just 10 minutes. Tonight. Now, number 5 is something that genuinely shocked me when I first saw the data, and I'd be willing to bet most of you are doing it wrong right now. Number 5, taking your blood pressure medication in the morning. This one I have to say carefully because I'm not telling you to change anything without talking to your own doctor first. But I am telling you to have a conversation you've probably never had. A landmark study published in the European Heart Journal followed over 19,000 patients across 6 years. What they found was staggering. Patients who took their blood pressure medication at bedtime instead of in the morning had a 45% lower risk of heart attack, a 49% lower risk of heart failure, and a 66% lower risk of stroke. Why? Because of something called nocturnal hypertension. Between roughly 3 and 6 in the morning, blood pressure surges, and that is the window when most cardiac events and strokes actually happen. When you take your medication in the morning, it peaks around noon and fades out right when your body needs it most. When you take it at night, it's working at full strength during that danger window. Please, bring this to your next doctor's appointment. Print it out if you need to. Ask specifically about bedtime dosing for your situation. It is a conversation worth having. And pay close attention to number 4, because these 2 habits work together in a way that makes both of them more powerful. Number 4, deliberate dehydration before bed. This one breaks my heart because the instinct behind it is completely reasonable. You don't want to wake up 3 times a night for the bathroom, so you stop drinking water after dinner. That makes sense on the surface. What it does to your blood while you sleep is something I wish more people understood. As we age, the brain's thirst signal weakens. Research from the University of Connecticut found that adults over 60 can be significantly dehydrated and feel nothing. No dry mouth, no headache, no thirst whatsoever. Your body simply stops warning you. And here's where it connects directly to your heart. Dehydrated blood is thicker, viscous. Your heart has to strain dramatically harder to push it through your vessels. Thick blood also clots more easily, and clots are exactly how strokes happen. A study in the American Journal of Epidemiology found that adults over 65 who were mildly dehydrated at bedtime had blood viscosity levels comparable to those measured right before a thrombotic stroke. The solution is not chugging water at 10 p.m. That will just send you to the bathroom all night. Instead, drink a full glass of water with a pinch of electrolytes, particularly potassium and magnesium, about 2 hours before sleep. A small sweet potato in the late afternoon, a few dried apricots, naturally rich in potassium, help maintain hydration through the night without overwhelming your bladder. The magnesium specifically relaxes arterial walls and actively lowers blood pressure during sleep. We're going to come back to magnesium at number 1. What I tell you then changes everything. Number 3, screen use within 2 hours of sleep. I had a patient, her name was Sylvia, 76 years old, from Nashville. She was doing everything right on paper: medication, reasonable diet, light exercise, but she had 2 TIAs, mini strokes, in 14 months, and nobody could figure out why. When I asked about her evenings, she described lying in bed every night for 2 or 3 hours with her tablet right up close to her face. News, Facebook, family videos. She thought it was harmless winding down time. Here's what was actually happening. The blue light from that screen was suppressing her melatonin. Most people think melatonin is just a sleep hormone. It is far more than that. Researchers at Harvard's Brigham and Women's Hospital showed that melatonin is a critical protector of the endothelium, the lining of your blood vessels. It acts as an antioxidant shield against the oxidative damage that causes plaque buildup, arterial stiffening, and eventually heart attack and stroke. Adults over 70 already produce 75% less melatonin than younger people. When screen light suppresses what little remains, that protective shield essentially disappears. A study from the Journal of the American College of Cardiology found that chronic nighttime light exposure was associated with a 43% increase in major adverse cardiac events in older adults. Sylvia cut screens off at 8 p.m. Within 4 months, her inflammatory markers dropped over 30%. She has not had a cardiac event since. 2 hours before bed. Screens off. No exceptions. Number 2 is the one most people dismiss when I say it out loud, and that dismissal is genuinely dangerous. Number 2, sleeping on your back. I know what you're thinking. I've lost my mind. Just give me 60 seconds. When you sleep flat on your back, gravity pulls the soft tissue at the back of your throat downward, partially or fully blocking your airway. That is the primary physical mechanism behind obstructive sleep apnea, a condition that affects an estimated 50% of adults over 65, most of whom have never been diagnosed because they don't know what to look for. During each apnea episode, your brain triggers an emergency response. Cortisol, adrenaline. Your blood pressure can spike to crisis levels, dozens, sometimes over 100 times per night. Each episode is long enough that you never fully wake up, long enough to cause cumulative, serious cardiovascular damage. The American Heart Association now formally lists untreated sleep apnea as a major independent risk factor for hypertension, atrial fibrillation, heart attack, and stroke. A study in the journal Circulation found that adults with moderate to severe sleep apnea had a 58% higher risk of fatal cardiac arrhythmia during sleep. This is how healthy-seeming people die quietly, in the night, in their beds. If you share a bed, ask your partner whether you snore or whether you ever seem to stop breathing momentarily. If you sleep alone, record yourself with your phone's voice memo for one night. The signs are usually unmistakable. Sleeping on your left side is dramatically protective. It also reduces pressure directly on the heart. A body pillow behind your back keeps you from rolling over. If you have a confirmed diagnosis and a CPAP you're not using because it's uncomfortable, please use it. It is genuinely keeping you alive. Now, number 1. This is what Walter's daughter and I talked about for a long time after we lost him. And this is the habit that ties every single item on this list together and multiplies each one. Number 1. Carrying unresolved emotional stress into sleep. I want you to think honestly about your evenings. Do you watch the news right before bed? Do you lie in the dark replaying a conversation that went badly, running through your finances, worrying about your health or your kids, or what happens if something goes wrong? Do you carry the weight of the day straight into your pillow? Researchers at UC Berkeley call this rumination before rest, and its effect on the cardiovascular system is not subtle. When you experience psychological stress, your body releases cortisol and adrenaline, the same hormones triggered by sleep apnea, but sustained. Chronic evening stress keeps those hormones elevated through the night and prevents something cardiologists consider essential: nocturnal dipping. In a healthy person, blood pressure drops 10 to 20% during sleep. That dip is when your heart and blood vessels do their repair work. In people experiencing chronic nighttime stress, that dip never fully happens. The heart never fully rests. A 20-year joint study by the American Heart Association and Johns Hopkins found that adults with chronic evening stress and worry had a 72% higher lifetime risk of fatal cardiovascular events compared to peers with lower evening stress. After age 70, when the body's ability to regulate cortisol is already diminished by roughly 40%, that number becomes even more dangerous. Walter worried every single night about money, about his health, about being a burden to his family. He never told anyone. His heart paid for it night after night after night. Here is what I want you to do instead, and please take this seriously. 30 minutes before bed, do 3 things. First, write down 3 things that went right today. Anything, however small. Research from UC Berkeley's Greater Good Science Center shows the single act measurably lowers cortisol within 20 minutes. Second, practice what's called 4-7-8 breathing. Inhale 4 counts, hold 7, exhale 8. This activates your parasympathetic nervous system, your body's built-in calm-down system, and directly lowers heart rate and blood pressure. Third, and this is the one I personally recommend to every patient over 65, take 200 to 400 milligrams of magnesium glycinate 30 minutes before bed. Not just any magnesium, glycinate specifically. This form crosses the blood-brain barrier. It calms the nervous system, relaxes blood vessel walls, and studies from the National Institutes of Health show it reduces nighttime cortisol and improves sleep quality in adults over 65 by up to 39%. It is genuinely one of the most powerful and underused cardiovascular tools available without a prescription. Think of it as giving your heart permission to finally rest. Here's what I want to leave you with. Walter's death wasn't inevitable. Looking back now, the late dinners, the blood pressure pill taken every morning, the deliberate dehydration, the back sleeping, the tablet on his chest every night, and underneath it all, a man who quietly carried enormous worry and never once let it go. Every single one of those things was changeable. Any one of them addressed would have helped. All of them together might have saved his life. I am not telling you this to frighten you. I'm telling you this because I have sat across from too many families in too much grief, and I refuse to stay quiet about things that are within your control. You are not fragile. You did not make it to this age by giving up. The people who love you need you present, not just alive, but genuinely, fully here, at the table, at the game, on the phone on a Sunday morning. Every single thing I described today, you can start tonight, not next week, tonight. All the studies I referenced are linked in the description below. Please share this with someone you love, a spouse, a sibling, a friend. You may genuinely never know whose life it reaches. And before you go, leave me a comment. Which of these 6 surprised you most? Are you going to make a change tonight? I read everyone. I'll see you in the next one. Take care of your heart. It's the only one you've got. The information presented in this video is intended for educational purposes only and does not constitute medical advice. I am a medical professional, but I am not your doctor, and this video does not establish a doctor-patient relationship. Nothing in this video should be used as a substitute for professional medical advice, diagnosis, or treatment from a licensed healthcare provider who knows your personal medical history. Always consult your own physician or qualified health provider before making any changes to your medications, supplements, sleep habits, or health routine.